I had a really good question from one of our physical therapists, and I wanted to share with you. We had a client who had a hamstring strain, grade 1, mid-belly, and they want to get back to weight training. They want to get back to lifting. And they were asking, when can I start deadlifting? When can I start using kettlebells? And I want to share that answer with you because I think it's very helpful. So before we decide on what exercise or whatever it is, you have to understand the mechanics. If somebody's 2 to 3 weeks out from a grade 1 hamstring strain, it's only ultimately going to come down to mechanics. What you need to understand is if somebody's picking up anything from the ground, where they place the demand is going to change how much strain that goes on there. So if this person's going to start with a barbell or a kettlebell or dumbbell, the question became, where do I start? Do I start from a hang position? When can I start from the floor? So if we're just talking about the floor, it's an easy answer. If they're 2 to 3 weeks out, you know that tissue's still healing from a grade 1. Let's assume that's going to be a 4 to 6 week process, but they want to get to lifting. They want to just get some joint nutrition. They want to get some blood flow and circulation in there. Then we have to decide, if we have option A, we have a barbell, that center of mass is forward. I put 3 bullet points here to help you process this and kind of navigate your own algorithm of where you would go with this. So in this first example, you have the center of mass, which is anterior or forward to their leg, knee, and shoulders. That center of mass is forward. So this total distance is now going to be greater. Now, what happens here is, because that center of mass is here, you actually don't need as large of a knee angle. So it's actually going to be a larger hip angle. So as they come down, that's a greater stretch on this hamstring, a larger range of motion for them to get down and load that tissue. Now, if we were going to have, in an ideal world, you would have maybe a hex bar. This person had a home gym, so they have kettlebells at home, or even dumbbells. You can just raise them. But ultimately, if we bring those by their side, instead of having the center of mass forward or anterior to their foot or knee, now we have center of mass in, say, their midfoot. Now that center of mass is actually going through multiple joints. Now they have to actually squat lower to grab that, and then now they can lift. That's going to create a larger knee angle, which puts less strain on the actual hamstring itself. This one here is going to require a larger stretch or demand. This one here forces them to use their quads. They can actually get down and squat a little bit more and use a little bit more hips instead of just getting a full stretch on the hamstrings. So if you have somebody who is asking, when can I go back? I think you have to understand what their demands are, what the equipment they have, and ultimately they need to understand these fundamental mechanics. Would you start a barbell? Absolutely not. I'd probably start them in a hex bar, kettlebells, or dumbbells, and you can put dumbbells on top of a box or a 45-pound plate or something where you raise that so they don't have to go so low to grab that. So you have the center of mass, which is also going to help you influence the knee and hip angle, which tells you how much strain is going to go onto that hamstring, and then ultimately what places the greatest demand on that healing tissue. So I would start with this, and I would even start with this as soon as week 2 to 3. And then you're starting barbell work at week 6 where they don't have that strain. You're not really loading it heavy. Now you could do this. Now you just won't pick up from the floor. Maybe you can pull it from a rack. So if you had a rack here and they can pick it up from there, they can do some lowering just maybe to the knee. But ultimately having a high load from the ground is going to be one of the hardest demands on that. So I wouldn't start doing that until at least week 6. So week 0 to 2, you're working on fundamentals, getting some blood flow in there. When can they start doing some resistance? Probably weeks 2 to 3 when they don't have any irritation bedding down. And then actually 6 weeks coming out of that, you actually do some barbell work. And then you're probably at 8 weeks when you actually start to increase load and demand on top of that. So I thought this would help. It was a great case that we went through, and really what it comes down to is, what is their demand? What are the supplies that they have at home? What's their timeline? Could you squeeze this in on a shorter timeline if they had an event? Maybe, but I would be more conservative on that front end and allow that tissue to heal and scar down a little bit more before you start loading it and placing a higher demand. So consider the center of mass, knee and hip angles, and the total demand on that tissue and what phase of healing they're going through. So hope that helps. Let me know if you have any questions.